Do you even know the most common cause of visiting a gynecologist is UTI? Burning micturition, difficulty while passing urine are the most common symptoms with which a female visits a gynecologist. So hello friends, I am Dr. Prachi Benara, fertility specialist in Gurgaon. So unfortunately, UTI is more common in females than men. Every second woman will experience this in her lifetime. Let's concentrate on the symptoms of UTI. Burning micturition, difficulty while passing urine, urge to pass urine, sometimes incontinence, severe pelvic pain, unfortunately sometimes fever, nausea, vomiting, and sometimes even pink or red tinged urine are the frequent symptoms which are associated with UTI. Let's understand what are the common causes of UTI. Sexual activity is one of the most common cause of UTI in women. Unfortunately, if our urinary tract has some obstructions in the form of stone, that can lead to UTI. Drinking very little water, holding urine for a long period of time can also be associated with UTI. If a woman is catheterized for a surgery or some intervention, that can also increase the chances of UTI. Frequent rubbing of vagina and urethra after passing urine with a tissue paper can unfortunately also result in UTI. Certain other diseases like diabetes, especially if it is uncontrolled, can also lead to frequent UTI. Certain other disorders like neurological disorders, for example stroke, can also be a high risk factor of UTI. Now let's understand what will the gynecologist or a urologist do if you're diagnosed with UTI. So dear friends, the most important part of diagnosis is performing a simple urine routine and urine culture. It is very important to examine your urine with how much quantity of bacteria does it have and which bacteria is actually infecting the urine sample and what is the antibiotics which can work against that bacteria is very necessary before commencing treatment for UTI. Going to the chemist and asking for self-treatment is not a good option. Popping in pills known as antibiotics can lead to antibiotic resistance, which can make them non-efficient when actually needed. So if you are facing these symptoms, visit a gynecologist or a urologist. They will conduct a simple urine routine and urine culture, find out the bacteria which is infecting your urine and then treat it with the antibiotics suggested in urine culture. Sometimes if we just pop in pills or do not complete the course of antibiotics, this UTI can become recurrent. Recurrent UTI can lead to other problems of the urinary tract. A very important discussion is how to prevent UTI. So drink a lot of water. Do not have a habit of holding urine. After sexual activity, pass urine. Clean yourself before and after sexual activity. Do not use any vaginal washes or deodorant. Wear cotton undergarments. Do not wear tight-fitting clothes for a long period of time. And if you've been diagnosed with any obstruction in the urinary tract like stones, visit a urologist and get yourself treated. Thank you.